Transplanted hair is falling out 5 to 10 days post-surgery. Follicular unit transplant. Date of transplant 4th of December. 2,000 grafts, 3,500 hairs. Is this a normality that the hairs are falling out this early in? I've read that the hairs usually shed after 3 to 4 weeks' time. I might have managed to dislodge a couple of grafts, but no more. Have the hairs anchored by this time? Certain areas are entirely hairless and scabless. Thus far, I've paid my doctor 2 to 3 visits ever since the hair transplant was carried out. He tells me there is nothing to worry about and that everything looks just fine. Thanks in advance.
Thank you for your question. You submitted a question stating that you have several of your transplanted hairs falling out 5 to 10 days after surgery, and is this normal? And that you have gone back to your doctor several times and your doctor has been reassuring you. Well, as a specialist in hair loss treatment, and we have been in a remarkable leadership position with a technology we developed called Hair Regeneration, which I'll discuss more in detail. I can share with you a lot about the experience of what hair transplant is and what it means when people lose grafts. You see, hair transplant literally is the movement of an entire hair follicle into a small slit. And usually what happens is the skin heals and the tissue heals well enough that majority of the time the dermal papilla, the part of the hair necessary for growth, can be intact even if a graft appears to fall out. The general term used for grafts falling out during this post-operative period, the early post-operative period, is called shock loss. Shock loss can happen to the hair grafts as well as the adjacent hairs that are subjected to the swelling and trauma of the actual procedure. In our practice, we've been doing our transplants with a material called extracellular matrix and platelet-rich plasma, and we've seen a significant improvement in the rate of shock loss so that this difficult transition period is a little bit easier. But even with advanced healing technology, we still have a certain period which you could sometimes call it the doldrums, where there's a whole lot of nothing going on. The existing hairs may look a little thinner, the grafts are not growing, you don't even see the grafts anymore, and you wonder somewhere in the the early 4 to 6 month period if you lost all the grafts. And so it's a little bit of a nail-biting period, but I can tell you that the hair is remarkably resilient. We know this especially from the field of laser hair removal, where people come for multiple laser treatments to actually kill a hair, whereas you really don't really kill the hair, but you probably suppress its growth for a long period of time. So, and also several studies have demonstrated that when hairs are transplanted, even if the dermal papilla, the base, is not intact and the upper part or the mid portion of the hair shaft is actually transplanted, a hair can still grow. The reality with hair is that there is so much we don't know about hair. When we developed our hair regeneration method, we looked at the basic science research to help us understand this better, and it is remarkable how much we do know, and it's also remarkable of how much there is left to know. And you probably will always hear periodically every few months a news report of a new method of potentially in the future hair cloning, but clearly we're not there yet. Another thing that I would suggest considering when I looked at your photo, I noticed that the level of receding of your frontal hairline You may want to discuss with your doctor the use of some type of oral medication such as finasteride, even though in the current time a lot of people are nervous about finasteride. In our practice, many people come to us for hair regeneration treatment, which is a non-surgical injection that helps reverse the thinning process of hair through a method that we believe is the restoration of critical stem cells as part of a wound healing mechanism that literally stops the thinning process. So many people who have had a transplant and would want to avoid a second transplant actually benefit because we're keeping the hairs. I mean, that's one of the things that, if we can go off on a little bit of a tangent, that we have certainly been incredibly gratified about, is that traditional hair transplant philosophy is that you restore to try to keep the appearance of hair in areas which are still actively thinning. So invariably a person who gets one transplant will need a second transplant, possibly a third or even a fourth, depending on how much donor they have. But unfortunately there's a limit in how much donor you do have. So hair regeneration has been able to balance out our hair transplant practice very well so that we're able to not only improve the transplant procedure but also prevent the progression and actually thicken and reverse thinning hair. Separate discussion, but something that I thought it would help you understand something about the physiology of hair. So essentially, you're going to have to wait this out. You're going to have to follow up with your doctor. And for most of our patients, we tell them that the final results are somewhere around a year to 15 months. There is a lot of variability between the hair growth cycles of individuals. And so some people grow faster, some people grow slower, but ultimately by the 1 year point, you are close to your 90% zone of recovery. And but we've seen even at 15 months, people, the combination of the loss from shock, whether it's the grafts or the native hairs, eventually synchronizes to the point where the growth and density actually match enough to give you a better sense of the final result. So I hope that was helpful. I wish you the best of luck, and thank you for your question.